Hello and welcome to the new School ObGyn podcast, a podcast in women's health, but for everyone. Our goal is to promote good and reliable knowledge because the source of your information matters. My name is Eric Schmit. I'm a board-certified ObGyn. Today I have with me Miss Rebecca Fansler. And today in episode 1, we're going to talk about exercise in pregnancy. Please consider downloading and following along. We are on all the major podcatchers, and check out YouTube for the video podcast. Okay. So, again, episode 1, we're going to talk about exercise in pregnancy. Hopefully something a little fun and easy to talk about. Becky, go ahead and tell us a little bit about you and your background.
Yeah, I'd love to. First of all, exercise is very fun. I might be biased, but I think it's very fun. Anyway, back to my background. So I have my undergrad from UW-Madison and Marquette University. I studied biomedical sciences and psychology. While I was working on those degrees, I decided to do what so many people seem to do and turn one of my hobbies into a job, and I obtained a personal training certification. I worked as a trainer for a few years, and then I went on to obtain my master's degree in regulatory science from Johns Hopkins University. And once I graduated with that degree, I decided to, again, pursue my passion, and I obtained a second personal training certification, this time in prenatal and postnatal fitness.
Perfect. All right. So why do we care so much about this? Well, there's a lot of myths to dispel as far as exercise in pregnancy, and we really want to promote both good maternal and fetal health. Pregnancy presents a unique opportunity where otherwise these young patients would not be seeking medical attention, but we're able to talk to them, educate against some of these myths. Some of those myths may be, that you should rest, take it easy in pregnancy, don't lift anything, let me get that for you, or you shouldn't exercise because it might cause harm to you or the baby, maybe eat for two. The new school of thought, and there's a lot of research out there too regarding the benefits, backing up the benefits of maternal and fetal for exercise in pregnancy. So Becky, tell us a little bit about those benefits.
Yeah, so let's start with the maternal prenatal benefits. So very first benefit we're going to see is improved cardiovascular fitness. So we're strengthening our lungs and our heart, and it's really setting us up for a better prepared delivery. We're also going to see a reduction or even sometimes prevention of back and hip pain that is unfortunately really common in pregnancy. We're also seeing an improvement in stability and balance with the strengthening of those core muscles. This is really important because the body is going through a lot of different changes, muscular, postural changes that are occurring during pregnancy. For example, as the belly's growing, your center of gravity changes, and most people will experience an anterior pelvic tilt, which is that forward shift of the pelvis. This is really what causes a lot of that back pain. Can also see a reduction, sometimes a prevention of urinary incontinence through the strengthening of the pelvic floor. And one of the, I think, most important benefits that you get with exercise is an improvement in mental health. So the biggest thing here is that it's helping to improve self-esteem and body image. This is really, really important when we're adapting to the changes in our body that come along with pregnancy, like an increase in weight, change in size. For many of us, the last time our body went through such major changes was puberty. And I don't think that was an especially fun time for really anyone. Also getting mood benefits, we're stimulating energy, and it's also a really great way to mitigate feelings of stress, anxiety, depression that can occur or increase during pregnancy as well.
Yeah, and those are all great benefits. Also include, to prevent that excessive weight gain, gestational diabetes, hypertensive disorders that may come up in pregnancy, low birth weight, and even higher birth weight or macrosomia for baby. Well, labor benefits, there are some also, and I think the biggest one or the most glaring one is it might increase your chances of a normal vaginal delivery. and lower that C-section risk. And yeah, the labor is a marathon. Sometimes patients are pushing upwards of 3 to 4 hours, not to mention that whole time beforehand, which the uterus is working for hours on end. So the healthy cardiovascular system, healthy muscles will help increase the chances for vaginal delivery and C-section. Also, it helps to increase the maternal plasma volume and increase the cardiac output, placental function. We know that a healthy placenta is very much needed for a healthy and safe delivery. And so, the second stage of labor, which is the pushing phase, can be shortened by as much as 50%. Again, 3 to 4 hours. 50% of that sounds really good. Those are some of the labor benefits. Some of the postnatal benefits. Go ahead, Becky.
So with postnatal, we're seeing a decrease in back pain, decreased amount of healing time, still getting those really great mental health benefits. So again, mitigating those feelings of stress, anxiety, depression. It's also a really fantastic way to get some you time or to find a way to bond. So mom and baby exercises. There are classes out there. There are YouTube videos. I'm sure we'll have some out there too. And there's also this old school of thought that breastfeeding can, while exercising, can negatively affect baby's growth. That is absolutely not the case. Breastfeeding women can exercise without negatively affecting baby's growth, but will need an additional 500 calories per day to support their own and baby's nutritional needs.
Perfect. And let's go to the baby side of things. We talked about the aid in managing babies' weight, so we're not getting excessively large babies. Also, decreasing the risk of labor complications or risks for baby by maybe not needing something like an operative delivery, or what we know more often as is a vacuum delivery, forceps delivery. While those are very safe things to do and are not rare things, they do have rare risks, and so hopefully if you don't need it, don't have to undergo those rare risks.
And then during exercise, another old school thought is that because you're seeing the fetal heart rate increase during exercise, they used to say baby's experiencing distress. This is bad, not good. Don't exercise while pregnant. Research is showing that yes, the fetal heart rate does increase during and after exercise. It's a very mild form of stress, but it is a positive stress. It is a normal response for the fetal heart rate to increase, and it is not harmful. Chronic prenatal exercise may have the same training effect and increase in heart rate variability on the fetus as it does on the pregnant woman.
If I may jump in.
Yeah, of course.
Two positive markers we look at for baby on reassuring ourselves on the antenatal testing, if we want to reassure ourselves that baby's doing well, is an intermittent increase in baby's heart rate or an acceleration in the heart rate, and good heart rate variability is also a positive marker. So just adding to those points.
Perfect. Thank you for that. This is like what we call an adaptive advantage. So these babies may also be able to tolerate periods of lower oxygen during delivery because of the physical enhancements of the maternal exercise. It's helping to provide them with better oxygen reserves. And then once baby is out, we're seeing slightly higher APGAR scores, which is always great to see. And then these benefits do extend into childhood. So they're getting some nice long-term effects as well. They're maintaining a lower fat or weight into childhood. There are higher scores on general intelligence and oral language skills. And there's also a positive effect of exercise on the fetal autonomic development, and the heart rate variability can continue into early childhood with steeper development trajectories in mental, psychomotor, and language abilities. And to date, no research has found a negative correlation with exercise. So,
Perfect. And to just add to all those points, when we talk about exercise in pregnancy, we are all talking about health, normal, low risk pregnancies, both maternal and fetal. If there are any risks in your pregnancy, please consult your provider to see or to make the best plan for you and the safest plan for you and your baby. So with all those nice points, well, how often should we exercise?
So that is a great question. And it does differ with the level of fitness that you're coming into your pregnancy with. So someone who isn't consistently exercising or maybe has never really found a passion for exercise, doesn't like to do it a lot, but wants to start, we would put you in a beginner category. So we would do a really gradual introduction of easy cardio, things like walking, maybe swimming, some stretching and yoga, and the addition of some light weights. So an example of what we would want to do for that introduction is maybe 2 to 3 days a week, starting at about 15 minutes at a time, adding on 2 to 3 minutes until you reach a max of 30 to 40 minutes. And so during that, we're increasing the frequency as you're gaining your strength and your endurance, with the end goal being that you are able to work out most days in a week. For someone who falls into the intermediate or advanced category, you can absolutely continue on with your current routine with some safe modifications when and if you need them. But really, to see all of the benefits that we've been talking about during this episode, you want to be exercising a minimum of 3 times per week for about 30 minutes of moderate exercise that is specific to your level of fitness.
Yeah, and to clarify on, at what capacity should one work out, the baby takes about, at points of the pregnancy, takes about 20% of the maternal cardiac output. And so kind of a good rule of thumb is to prevent, things like maternal or moms getting lightheaded, dizzy, or baby potentially not getting enough of that output. And perfusion is don't exceed 80% of your capacity. So if you have a maximum, you stay about 20% under that, at 80% or below. And there's also some good ways to quantify that.
Yeah, and if you're wondering, how do I know what 80% of my max capacity is? There's actually a really easy way to gauge that. It's called the rate of perceived exertion, or the RPE talk test. And really all it is you're working out. If you're still able to have a conversation with someone without having to stop and catch your breath mid-sentence, you're fine. If you do find yourself having to pause every couple words to catch your breath, that's really a good sign that you need to dial back a bit in your exercise. All that being said, the absolute most important thing to do is listen to your body's needs that day. Every day in your pregnancy might feel a little bit different, and honestly, some days might just feel like you're trying to survive. So listen to your body, either scale it back, or if you're feeling really good, push maybe a little bit. But yeah, listen to your body.
Yeah. Okay, so we talked about all of these exercises, the positives. Well, what are things we should avoid, or are there risks? And one of the things that we're constantly battling in pregnancy is dehydration. And so if you're going to plan a workout, make sure you're nice and hydrated beforehand. And always carry that water bottle with you to track, to make sure you are hydrated. And then also a thing to avoid is trauma, and this can come in a number of ways. One, we want to reduce the risks of falls, and so maybe things like jumping or other activities where you're at increased risk of falling. Avoid those, or any activity where you're working with some sort of tool or instrument for your workout that could cause abdominal trauma. Other activities that may, one thing to keep in mind too, again, is that the joints of the knees, the hips, basically all the joints are a little more lax, but you really have to protect those in pregnancy to avoid any severe injuries to those joints. And maternal temperature is another thing which you may have heard, don't do hot tubs, and that is said because early on in the pregnancy, really first trimester when organogenesis has happened and baby's organs are forming, an increase in mom's temperature where she can't regulate it could cause potentially some detrimental consequences. And so avoiding things like hot yoga, hot Pilates, if that's a thing, or the really hot days outside, again, where you can't really regulate your temperature or find shade, is something you should avoid, especially in the first trimester, but also throughout the pregnancy. Blood flow to keep in mind, and this, the same idea with laying on your back for extended periods of time, which I think we'll get into more detail in another episode, but certain exercises where you're just laying on your back and that we call it supine position may need to be modified a bit to make sure that moms are getting good blood flow back to the heart, so they can perfuse not only themselves but baby. And then altitude. Now, along the same lines, higher altitudes have decreased oxygen, and so your oxygen saturation could go down. So if you're someone that lives closer to sea level and you go above 6,000 feet, you really shouldn't exercise. Or at least allow your body to acclimate, and this could take days, potentially like 3 to 5 days of acclimating to the altitude before you should attempt to work out. Okay. And just to touch on one last thing, in the postpartum period, are there any specific things to keep in mind? And yes, it may need to be tailored given the birth in every situation. I do have a lot of patients coming back, and they had normal deliveries, and they're saying, when can we work out? Well, probably could start working out, maybe 3 to 6 weeks after the delivery. You can start with mild to moderate exercise. Those first few weeks can be a little more active, walking around, getting back to your normal self. But after a C-section, you'll have more lifting restrictions, and definitely need to talk with your provider about that. But you can definitely do more walks as you're feeling. So it's just you may not be able to lift or engage your core as much as you would normally like to.
One final note before we wrap things up. Be kind to yourself. You just created and birthed a whole human, maybe more than one. And a full recovery can take anywhere from 6 to 12 months. So please keep that in mind. Please be kind to yourself.
Perfect. And that is it for today's podcast about exercise and pregnancy. Thank you for listening and viewing. If you watched on YouTube, if you have any questions, please let us know in the YouTube comments. As always, the content of this podcast and video are for educational purposes only. None of the content is meant for personal medical advice. Please contact your medical provider if you are in need for personal medical advice. Thank you and have a great day.